Thank you very much. My name is John Hagen, and if you've been to any of the prior 12 conferences, you probably have met me or seen me because I've been at all 12 of them. The first Head Start Research Conference was held June 24th, 26th, 1991 at the Crown Plaza in Arlington, Virginia. Since that time, all of them have been in Washington, D.C., but at 3 different hotels. And this is our 3rd time in this facility. Faith Lamb Parker, who is seated down here, has also been involved in all of the conferences. This is the first time she's not the project director of the conference. That first conference was, the lighting is very bad because they're recording, and that light far dominates anything that we have on this side, so I'll have to change the focus here just a little bit. So that conference in 91, there were 67 pages in the program. By the 6th conference, there were 85 pages, and it was a great increase in the quality as well as the diversity. Researchers, policymakers, and representatives of Head Start were all very well represented. It's enlightening to reflect on the changes that have happened and what's remained the same over the past 12 conferences in 25 years. Faith Parker has moved twice but continued her role for each conference until this role. I have represented the Society for Research in Child Development as the research organization for all 13 conferences. For conferences 2 through 9, the host hotel was the Hyatt Regency on Capitol Hill, and just last night our cabbie got mixed up and took us to that hotel again. So apparently that's still an issue of keeping the Hyatts apart. 2 striking changes are apparent over the years. First, increases in attendance. The first conference was about 300 people. Then the conference is increased up to about 800 for many conferences, for many years. And now for the last 3 years, our attendance has been between 1,200 and 1,300. So clearly there's been great increase in the interest in these conferences. Perhaps even more remarkable is the great increase in both the size and the quality of the program presentations. We've gone from 3 or 4 simultaneous sessions to 8 or 9 simultaneous sessions, which you will notice is what we're doing for the conference today. I also want to point out the name change. I'm sure you all recognize that this is not called the Head Start Research Conference anymore. I have my own theory. I don't know that the people will agree with me or not, but when we first started this conference planning, we wanted to avoid a conference 13. Tristodecaphobia is the phobia of the number 13. So my theory is that Naomi, Wendy, and others figured out if they started with a new title, this is now the first National Research Early Childhood Conference. So we can go 12 more before we have to face that dilemma again. There are many organizations and individuals who are involved in planning this program, and you're going to hear in a couple minutes who some of these people are and who the program committee are. There are 3 different planning organizations, and it's really remarkable how many people and tasks there are to pull off a conference like this. The general contractor for this conference is Company Impact, and we are very grateful for the excellent management and involvement of Annie Oliver, Morgan Molnar, and the other wonderful staff that have been working with us now for almost a year. The University of Massachusetts, Boston, is the home of our new project director, Rachel Cohen, And so they now are part of the group as well. We've had several other universities represented. SRCD is the only organization to have played a role in all 13 conferences, and it serves as the professional organization representing research and child development. We have, I think, a very nice display giving you a lot more information that's over where the escalators come down, so I hope you'll take some time to look at that if you're not already familiar with SRCD and what they do. The conference could not be held without the enthusiastic support and the funding from the Administration for Children and Families, which is part of Health and Human Services. The specific offices there are Planning, Research, and Evaluation in conjunction with Head Start. I now will introduce Lonnie Sherrod. Lonnie is the current Executive Director of the Society for Research and Child Development, a post I held for 18 years before Lonnie. He oversees both the executive office in Ann Arbor and the office here, and SRCD has recently announced that these offices are going to merge and will all be here in Washington, D.C. I think it's going to take a year and a half or so for that merger to happen. He also was a member of the program committee of this conference for several years in the beginning. Lonnie?
Can I go up there?
Oh, sure. If you can see, go up there.
Good morning. As John said, I'm Executive Director of SRCD, and my comments will be short for two reasons. One, my research has focused on youth and adolescence, so I don't consider myself an expert in early childhood. And two, John said just about everything I had planned to say. So, as John said, SRCD has been a co-sponsor of this meeting since its inception in 1991. And at that time, John was Executive Director of SRCD, and I was at the William T. Grant Foundation and served on the program committee. John has remained involved with the conference past his retirement from SRCD, and now Dr. Martha Zaslow, who directs our Office of Policy and Communication here in DC, represents SRCD on the program committee. I've been pleased to watch this meeting grow in size and prestige over the years since it began in 1991. I understand that the registrants this year number greater than 1,300. That's the size of a small professional association meeting, and it really says something about the importance of this area in research on children. Also, a few years ago, an international dimension was added to the conference, which I consider very important and meaningful, because when I began this job as Executive Director of SRCD in 2008, we were beginning a collaboration with UNICEF on early childhood. That had a conference at the Bellagio Center in Italy and produced a volume published by Oxford University Press. But again, because early childhood was not my area of expertise, and I was very impressed with what an important topic early childhood is worldwide. But other countries need help in understanding that early childhood involves more than survival. It also should include concerns for learning and development, and programs to promote it should do those, and that's what the collaboration with UNICEF was all about. This year, the focus has expanded from Head Start to early childhood generally, and I'm sure there are more important reasons than it being the 13th meeting, but I think that represents an important advance in the meeting. So I won't take more of your time because I don't have expertise here, but I want to welcome you on behalf of SRCD. Thank you for your participation, and I hope you have a very interesting and productive meeting.
Naomi Goldstein is the Deputy Assistant Secretary for Planning, Research, and Evaluation. She advises the Assistant Secretary for Child children and families on improving effectiveness and efficacy of ACF programs. Dr. Goldstein joined ACF as director of OPRI in 2000. She became director in 2004 and deputy assistant secretary in 2015. Previously, she served as director of the Division on Child and Family Development. I'm pleased to introduce Naomi.
Thank you, John and Lonnie, and I'm really pleased to add my welcome as well. I wanted to mention a few things that are new about the conference this year. First, it's already been mentioned that we've changed the name to the National Research Conference on Early Childhood. I was born on Friday the 13th, so I've always considered 13 to be my lucky number. And I think it looks like a great 13th conference. In fact, we changed the name to better reflect the cross-cutting and broad nature of the conference and in sync with larger efforts at ACF to integrate across all of early childhood programs. So I think Linda will probably talk more about that. This year, we'll be live streaming plenary sessions and master lectures and a few other sessions that will be held in this Constitution Ballroom. So the sessions will be available to people who are not here in the room, and hello to all our participants out in internet land. Those sessions will also be recorded and archived so that you can watch them later, and we're quite excited about this advance. We've also introduced a mobile app for smart devices this year. You can download it from Google Play or the App Store, and it's way cool. You can scroll through the agenda. You can create a personalized plan by favoriting the sessions that you want to attend, and it will just pop up and tell you where to go and when. You can create a profile so other attendees will know that you're here, and you can look up and see who else is here. And you can also link to the live stream through the app if you happen not to be in the right place at the right time. We're also on Twitter, so please share your thoughts using the hashtag NRCEC2016. You can tweet through the app or directly on Twitter. And remember, if you'd like us to see your tweets, you have to adjust your privacy settings. And if you'd like us to appreciate and retweet your tweets, please be respectful and constructive. On that note, we'll be sending you an online survey for feedback after the conference. Please do let us know your thoughts, what you loved, what you'd like us to change. We pay very close attention to the comments, and if you give us comments, you can help shape the 2018 conference. I want to mention a point about seating in this room. Although it's a large room, there will be seating limits on the breakout sessions and master lectures that are held in the room, and that will be, seating for those sessions will be first come, first served. But if there's no room for you, you can watch through the live stream on your phone, or you can watch later after the sessions are archived. I have a number of important thank yous, although some thank yous have already been said. They haven't been said by everybody, so I have to put mine in. I want to thank Wendy DeCourcy, our federal lead for the conference. And Meryl Borofsky, who is perhaps can pause typing to be thanked. To our executive committee, John Hagen, Marty Zaslow, Ayoma Iruka, and Rachel Chazen-Cohen. As has been mentioned, Rachel is now the scientific director for the conference. And I, of course, have to acknowledge Faith Lamb Parker, who served as scientific director for more than 2 decades. We're delighted that Faith continues to serve on the program committee. She's left big shoes to fill. Fortunately, Rachel has big intellectual feet. So we're really happy that Rachel has taken on the role as scientific director. I also want to thank the members of the program committee. They have worked for months to develop the invited sessions for the conference based on their collective massive experience across early childhood policy, advocacy, practice, and research. You will see them wandering the halls and attending sessions and facilitating sessions. They'll be wearing special ribbons. They are too many to mention, but I'd like to ask the members of the program committee to please stand up for a moment, and please join me in thanking them. Thank you to our colleagues at ACF in the Office of Head Start, the Office of Child Care, and the Office of Early Childhood Development. We work together not only on this conference, but day to day and year to year, working to serve young children and their families, learning and improving together. And finally, I'd like to thank our cooperative organizations, many of whom have display tables at the conference. I encourage you to stop by in those tables to find out the latest in technical assistance, advocacy, professional development for researchers and practitioners. I'm excited about our opening session that will start in a few minutes on access to quality care and the many other sessions that will be offered over the next 3 days. Skipping right over that territory, to the end of the conference, I want to recommend to you the closing session at 3:30 on Wednesday here in the Constitution Ballroom. This is the Ed Ziegler session. Clancy Blair and Stephanie Jones will discuss self-regulation and executive function and will present a conceptual overview that can be a resource for both research and practice. This is the last of many sessions at the conference that will address executive function and related topics, and the subtitle for this one is The Forest and the Trees. So I'm sure that Drs. Blair and Jones will provide excellent guidance through this territory, which can sometimes be complex and a bit confusing. Excuse me. I want to pause for a moment to acknowledge events in the wider world that are on all of our minds. Last week's tragedies make me especially grateful to be here with you this week. You've probably all heard about how Mr. Rogers' mother used to tell him to look for the helpers when he saw something scary on the news. Well, look to the left, look to the right, look all around this big room. You are the helpers. Thank you for being here, and thank you for all that you do. With that, I'm pleased to turn to my colleague, Linda Smith. No one works harder or fights harder for children and for the adults who help them than Linda Smith.
We're most pleased that Linda Smith can be with us for this opening session. She's the Deputy Assistant Secretary for Early Childhood Development for ACF. In this role, she provides overall policy coordination for Head Start, Early Head Start, Child Care and Development, and serves as the liaison with the U.S. Department of Education, as well as other federal agencies. Her office is the focal point for early childhood policy.
Thank you. Well, I, like Naomi, want to welcome you to this first conference on early care and education. And I really do want to thank each and every one of you, because this has been an amazing last couple of years for early care and education in this country. And I think it's because of the work that so many of you have done over the years that I think we are finally over the hurdle in this country of whether or not we believe that the first 5 years of life really make a difference. I think the country is now with us, and I think that the credit for that belongs to many of you in this room who have spent a lifetime working on this issue. I know that in this room we have about 50-50 researchers and program people, which is, in my world, ideal, because we need both, and I'm going to spend just a second in a minute talking about that. We are in the 9th inning of this administration, obviously. We are getting close to the end of the Obama's term, and I just want to say that we're not yet done. Because we still have things that we need to get through, and I'll talk about those in a minute. But our agenda has been, and hopefully will continue into the future, to be one of a birth to 5 agenda, a seamless system of early care and education for this country that it doesn't matter where children are, that wherever they are, they get the same level of quality no matter what. Our children deserve that, and that should be our goal. So that seamless system is reflected in the change in this conference's title and goals, is that we, no matter where we are serving children, those children need to have that same agenda, and they need all of the things that any program can offer. So we renamed it. It follows much of the work that we've done over the last several years in early care and education in this administration. As many of you know, we recently reorganized our offices in the early childhood development offices to do the same thing, to walk the walk that we talk when we talk about alignment out in the country. As a part of that, we realigned our training and technical assistance system so that all of our products and our work and efforts go to all children, not one or the other. A child in Head Start and child care should be getting the same thing, and those who care for them should get access to the same things. We've issued a number of joint policy statements internally within HHS, as well as across many departments within this administration. All of those start with, guess what? They start with, what does the research tell us? So if you look at any of the policy statements that we've done, they start with the research. And finally, the other thing that we have done has been the early Head Start child care partnerships to align, and for the first time in this country, I think make child care and Head Start sit down and really think this through and understand each other. And I don't think that had happened until these partnerships came into being. So we've got a lot of things that we've accomplished, but where are we? What do we have left? Well, for those of you who haven't heard, we are soon to publish the Head Start performance standards. We have worked for several years now on these, and I hope that when everyone sees them, people will really appreciate the hard work that's gone into these standards. They were completely redone. We did not start and edit and add to and layer on to the old standards, because that has been what has been happening for decades. So we have completely new standards. You will be seeing them towards the end of this summer as they are moving very quickly to finalization. The second big thing that we have yet to do and finish is a child care rule. We are working and have published a draft of that. That child care rule will be out hopefully in early fall. So we have had an unprecedented opportunity in this administration to do the work that I've been talking about, to align these programs and to look at how we can create more synergy and collaboration between the two of them, rather than seeing them as distinct and different programs. As we've done that work, we have aligned the standards, but with the child care, the rule, and the Head Start performance standards, we've taken every opportunity we can to look at these things and say, where can we make these things work together so that we don't have conflicting rules and regulations within early care and education? And that work you will see when you see the child care performance or the child care rule come out. So it's been, again, an amazing time to be in this position, to be doing this work, because this alignment, we think, will set early care and education on a new trajectory for this country. We have, for a long time, struggled with these stovepipes and everything else, and the disparate quality between Head Start and child care. And we all know that it exists. Anyone sitting in this room knows that. While we have good child care programs, we also have more that need a lot more help in getting to the levels of quality that we see Head Start as providing. So what we now see, and you will see this coming out in a couple of policy statements that we're yet to release. We see Head Start as the goal for this country, and child care now, because of the Child Care and Development Block Grant and the new rule that we're going to be putting out in child care, as we now have a foundation for child care that we're going to build on because of the new law, and we see Head Start as the goal for all of our programs. And so as we begin to build this continuum and this pathway for child care to reach the quality levels that Head Start has, we need to be thinking carefully about all of the pieces of the puzzle and what they mean to both programs. And that's why I say, well, we have now very minimal training requirements in child care and a degree requirement in Head Start. There was a time in Head Start's history when the goal was a CDA. Now we are 70-some% degreed teachers. That's exactly what we need to view for childcare. The goal may only be a minimal amount of training, but we need to put our child care workers on the same pathway that 40 years ago we put Head Start teachers on that pathway. So that's our continuum, and when we release the 2 rules, you will see I think that vision coming out. So I'm going to close my remarks by saying a couple of things. If you know me and you've ever heard me speak, you know that I say policy is a combination of research, data, and stories, or examples, however you want to put that. We need all 3. And that's why it is so wonderful that we have the audience mix that we have here today, because it isn't just research, and it isn't just data, or it isn't just anybody with a good story to tell that's going to make a change in our public policy, but it's all 3 of those things. So keep that in mind as you work through the next 2 days, and think about how research and data come together with the programming and examples and stories that we all have to bring this country to higher levels when it comes to early care and education. I have one request. I think I've said this in the past when I've talked to this group. We need your help in the policy world. You know many, many things within the research community. What we need your help on is translating research into practical terms that policymakers and people in government can really take and use and promote early care and education. I know sometimes that we sit at a table, and we do, and Naomi said it earlier, we see this as a partnership with OPRE and early care and education programs. And we talk about this all the time. What are the needs? What are the asks? So forth. But what we need from you all is to, at the end of your research, is to tell us what's the bottom line? What does it really tell us that we need to know? And in words that we can take to policymakers that make sense. So I know that's a challenge, because someone told me just recently, as researchers, many of you have been taught to write in all of these big scientific terms. But when it comes to people understanding the research and translating that into policy, we have got to transition from that, all of the research terms, into real terms that real people can understand what it is we're trying to do. So as you close out each of your sessions during this time, I would really like for you all to think, what's the one, and I'll quote this colonel I used to work for many years ago, and he'd say to me, Linda, write simple, stupid. And you know, I actually was thinking about this coming in. Secretary Sebelius, when I first came here, said the same thing. She said, you guys talk in jargon. For example, we talk about dosage, and in the medical world that means a prescription. How many pills are you going to give them? And we don't necessarily talk in a language that the people around us understand. So my challenge to each of you, as you finish your sessions out, what is the one simple, stupid question that you would say as a result of the research or your session that people can take away and use as they talk to policymakers or people who might be funding them or people who may want to support them but don't know why? We need those simple, stupid terms. So again, thank you to each and every one of you. I get a little emotional understanding that this is really the last year that we'll be here with this conference, but it feels so good to see how far we've come over the last several years in early care and education. And I just thank you from the bottom of my heart to each and every person in this room who's spent a lifetime working on this. Things are going to improve in this country for young children. I feel it in my bones, and it's because of the work that you've done. So thank you all, and have a great conference.
We now need about 2 minutes for those of us here to get down to the audience and for the plenary speakers to come up here. So we ask that you just stay in your seats, and we'll be ready in a couple minutes.
Hello. No last minute running. Okay, we're going to get started. Okay, so I think we're about 12 minutes behind, so I will be very brief and try to keep us moving. I'm Krishana Lloyd. I'm representing the Nicholson Foundation today, and I'm very excited to be here. I think for the past few years, we've really seen the commitment to early childhood development and education grow by leaps and bounds on the federal, state, and philanthropic levels. This opening plenary is really focused on helping us to think broadly about high-quality early care and education and the types of innovative efforts that are happening across the country to ensure that parents and caretakers who desire access to this care have it available when they want and they need it. So we're going to begin the plenary with Shannon Rudisill, and she is Associate Deputy Assistant Secretary for Early Childhood Development. And Shannon's going to offer an overview of policy initiatives aimed at expanding access to high-quality care. The second presentation will be Sarah Friese, and she is a Principal Policy Analyst from Child Trends, and she'll talk to us about the development of a framework that's being worked on by a group of experts at the Office of Policy Research and Education, OPRE. And that framework is really designed to think about how to access high-quality education and care. And finally, we'll hear from Veronica Ray. And Veronica lends a practitioner on the ground voice as the Executive Director and Chief Executive Officer of the Leaguers, and the Leaguers are located in New Jersey. She's a past president of Region 2 Head Start Association, and she's the current president of the New Jersey Head Start Association. And Veronica and her staff have been leading the early Head Start child care partnerships in the state of New Jersey since February of 2015. So she's going to talk about promising developments from the partnerships, as well as some challenges that have been faced. And then we'll bring it on back in again by hearing from Shannon. He'll just kind of wrap up things and serve as a discussant from the presentations. And throughout the three presentations, there'll be attention to not just talking about what the research is showing, but what tools are being developed to track access and quality, including formalized instruments and concrete real-world findings. So we're aiming at about 7 minutes per presenter, with about the same time for the wrap-up and the discussion. So it's a really very tight schedule. We'll do our best to reserve some time at the end for Q&A, but do know, given the delay, that may not be possible. As you can see, we really do have a distinguished panel, and like Linda, I've always felt very strongly about having multiple perspectives at the table. I am a practitioner turned researcher, and recently in the philanthropic world, so I think I'd want to add that extra P. We've got the research, the practice, the policy, and I really think we need to start thinking about how to bring philanthropy in the room as well. But we did make a very deliberate effort to kind of get out of the ivory tower here on this presentation and to bring you multiple perspectives. So I'm sure you're going to come away much more knowledgeable than when you entered the room and excited about the next few days. So I'll turn it over to Shannon.
Good morning. It's my pleasure to be here with you. It always is a pleasure to be in a room where OPRE has gathered researchers to talk with those of us who have to think about decisions we have to make about programs every day. And I thought a little bit about, okay, why this presentation to kick off our first early childhood conference. And I want to just, before Sarah presents the project that she's been working on, I thought that might provide a helpful context for you as you listen. Why would we choose this topic about access to early care and education? And I think it actually is very foundational and a great way to start our thinking cross-sector at this conference, or at least our formal thinking. As OPRE reminded us frequently, it's frequently been cross-sector, but our more formal acknowledgement of the cross-sector nature of ECE. So first of all, one thing I want to say is this topic, access to early care and education, as I was thinking about it, it seems more complicated than access to most other analogous things that I could think about. Because if you think about your planning for public school enrollment in your city or whatever, you can, this is maybe oversimplifying, I've never done it, but it seems like you could look at residential patterns, look at the census, you might have some idea of how many people typically opt for private school, and you could plan about how many seats you're going to need here or there. Maybe significantly more complicated in places where there's more choice, but you could plan it, right? I mean, other things like that hired, it seems like it would be a little easier to plan ahead for what you need and where it would be. And early care and education, the project that Sarah is going to discuss, is really thought about the very, very complicated world that we're living in when we try to figure out access, because it has a lot to do with choice and preference and two clients, if you will, a parent and a child. So when I was thinking about this, the first thing is access to early care and education cross-sector. So what that means for us, as opposed to thinking about pre-K uptake, which is complicated enough. We had to do it when we put together the President's Strong, Smart, Strong Start proposal, we're thinking not just about that, but we're thinking about, well, what Head Start is already available. And we're not just thinking about 4-year-olds, because the other thing we're trying to do is we're trying to think birth to 5, and how is it going to interact if we manage to have access to one age group for 4-year-olds? What will that interact with access for birth to 3? Yes, we believe it will. So we have cross-sector, we have dual generation, because we're trying to both create something that works for early care and education for children, but we also have parents' work and school needs. And we have supply across the age spectrum, and the fact that the age spectrum interacts, as Linda talked about. And of course, we also have a wide diversity of kids, whether we have a lot of dual language learners, changing, evolving immigrant population in a given place, and kids with special needs. So this is an extremely complicated endeavor. And I'm telling you this because I want you to know that in policy, and many of you have heard me say this before, and I think Linda was alluding to it earlier, we are frequently asking, pressuring y'all to simplify what is going on, right? So I think we should acknowledge up front that this is a complicated endeavor, but in order for us to make reasonable management and policy decisions, we do need to reduce it down to things that are answerable and that we can make decisions on. And that's sort of the context of the project that Sarah has been working on for us, which is to try to wrap arms around this and get this into a framework that we could actually use to make planning and policy and management decisions. And the framework she is going to show you, I think, may seem complicated if you're primarily used to working in one sector or with one age group. I will tell you that relative to other things that we have tried to look at in the past, it is relatively simplified. And so I think that there's been some success in that. And when we talk about the policy context, the kinds of things that we've been doing, I'm not going to give an exhaustive list because Linda talked about it a little earlier. But when we think about our goal that Linda mentioned, high quality comprehensive services for all families who need them at the schedule that parents need for work and for school, we've done a bunch of things, but I'll just, to get your mind thinking this way, I'll mention a few. You might have noticed that we've been talking about longer day and longer year in Head Start, which is both about, because we think kids need more dosage in order to reach our child outcomes that we're aiming for, but also to better meet the needs of parents who are engaged in work and school. We've been looking at massive pre-K expansions, but the vast majority of those, with encouragement from us here in the federal government, have been in community-based settings. And we've been looking at the early Head Start childcare partnerships, and Linda talked about these, but I'll just give an example. It really has helped us sit down, and Veronica is going to go much more in detail about how it's worked for her, not only to look at what has to happen in classrooms to provide high-quality comprehensive services, but they're also sharing information about management and fiscal that are a little bit different and increase our understanding of what we're going to need to do to reach this goal. So for example, I think the Head Start side is frequently bringing to the table how you would staff for not only lower ratios, but also for appropriate planning times and reflective supervision and breaks. I think on the childcare side, they're bringing, okay, I need to do all of that and be open 10 hours a day and be able to actually finance this thing, right? So, we're really coming together on those kinds of things. I would say that I think that the National Survey of Early Care and Education, which was a huge project of OPRE, shows that those of us in the policy world, and I don't feel like I can speak for the research world, but those of us in the policy world and federal level, we feel like we're leading and being in front, but we're a little behind reality, because what we learned there was that although much of ECE is in private settings, whether those be nonprofit or for-profit, 73% have some government source of revenue. So this is really a mixed picture. And also, they have multiple sources of revenue. A full 75% of early care and education center-based establishments had 2 funding streams coming in, 2 sources of revenue, but a fifth had 4 or 5 sources of funding coming in, which means that it's not Head Start pre-K childcare. It's Head Start pre-K childcare. So when we talk about it and we think about it, we're living in that complex reality that I think folks like Veronica already are on the ground. I think she's got some of that going on in her own program as well. So those are just some things I would ask you to keep in mind as you hear Sarah describe the work that she's doing around the definition and how we can measure access. And then at the end, I think we'll talk a little bit about what uses we hope that this will have for you all and for folks across the country as they work on this issue. Sarah?
I do have some, there we go. All right, so as Shannon mentioned, I will be talking about a little bit about how to understand this idea of access as a really big concept, and then also how to measure access and how to track access and why that's a really important task. There we go. So just before I start, the project that Shannon mentioned that I'll be talking about has been funded by the Office of Planning, Research, and Evaluation. And it is part of a contract with Child Trends called CPRA. And just to mention that this work is currently underway. It hasn't been finalized yet. So some of the ideas I'm talking about are really just in the formation stage. And so just keep that in mind. So what is access to early care and education? So I think this is a really big topic, and as Shannon mentioned, we're really going to focus on what access is across settings. And I think it's important to have a shared concept of access because traditionally, access has been defined as a lot of different things. Some people think of it as availability, like what are the number of programs or what are the number of slots in programs? Are those programs affordable? Do kids with special needs have access to the care that they need? So there are all these different components that people have thought of when they talk about access, but there really isn't, there hasn't been traditionally a kind of holistic way of thinking about access. And so to address this kind of gap in our understanding of access, as part of this project, we convened a panel of experts in the field of early care and education, and just kind of wanted to pick their brains and get a sense of if we were going to have a really comprehensive definition of access that we could really use and operationalize, what would that be? What would we include in that definition of access? And so as part of that process, we came up with this definition of access that you see here. And I think if Bobby Weber is in the crowd, I think she is the first person who kind of proposed some version of this definition. And it is that access to early care and education means that parents with reasonable effort and affordability can enroll their child in an arrangement that supports the child's development and meets the parent's needs. So what this definition of access does is just gives us kind of a framework for understanding all of these different but related components for access. And you can see here that we've kind of focused on 4 primary dimensions of access, or categories within this larger concept of access that we think are important. So reasonable effort, and we'll talk about what these mean in a little bit. I'll try and not get too jargony and take Linda's guidance in that regard. Affordability supports the child's development and meets the parent's needs. One thing you'll notice is that this definition of access is really coming from the perspective of the parent. And I think that was an intentional decision that was made to reflect that access is something that's experienced by families. But the goal of this definition is to be flexible enough to really account for how access affects programs and communities and states as well. So why is tracking access important? To identify baseline needs and where gaps are, to track those gaps, or as improvements are made, to address those gaps, to assess how effective those initiatives are to understand how the early care and education that parents are able to access is really meeting their needs and their children's needs, and to really unify measurement across settings, as Shannon mentioned. So there are a couple issues that are related to understanding access across settings. One is that the availability and the quality can really differ between settings. So for some settings, there's a lot of care available, but it's not necessarily high quality. And then sometimes for programs that are state pre-K or Head Start, it's really high quality, but it's not necessarily available. Or there's some way or mechanism that limits who can take advantage of those programs. So we really need to look at the intersection of those two things. And then also the characteristics of programs. So do they operate at the times that parents are working and they can actually go to work and get these? So if they're working in non-traditional hours, is there early care and education that's available to them during those hours? Are the available slots for the children that are their children's ages? So there might be care that's available in their community that's really high quality, but they might have an infant and toddler, and none of those slots are infant and toddler slots. So these are some of the things that we're thinking about when it comes to understanding access across settings. So here you can see that, based on this graphic, we have this idea of access. It's a framework. It's not something that can be measured on its own. There's no indicator or metric for measuring access. And so we have this concept of access, and then we have these 4 dimensions, these categories or ways of thinking about access. And then at the bottom, we have the indicators. These are actually the measurable components of access. So these are the things that we can take and measure, and when we combine them together across the dimensions, and we do that over many different questions when we're asking different questions related to access, that's how we get to that higher level concept. So this just gives you a couple of examples of what some indicators for each of the dimensions are. So you can see in reasonable effort, what is reasonable effort? So reasonable effort tries to capture traditional concepts related to availability, but extend that concept a little bit further to include the geographic location of programs, because since access is really a community-focused issue, parents can only travel so far to get to certain care. And so if it's out of their geographic location, they don't have access to it. So reasonable effort includes geographic location, and then also this idea that parents should be able to have information so that they can make choices. So they need to have some way of knowing about what's out there and available to them. So some of the indicators of that might be the supply of programs, the number of slots, the desired capacity of programs. So that's programs, not what they're licensed, the number of children they're licensed to serve, but the number of children they'd like to serve. And then in affordability, that's a pretty traditional concept related to access. Some indicators within that dimension would be the portion of parents' income that they would use to pay for care, any subsidized contribution, parent contribution, any program fundraising that the program might do to supplement what they're taking in to support the true cost of providing ECE. Supports the child's development, the quality level of the program, whether specialized services are available for children with unique needs or special needs, meets the parents' needs. These are indicators that are really focused on parent characteristics or program characteristics, because this dimension is really reflective of whether parents can get the kind of early care and education that they want. So do they have a preference for a specific program type for certain age groups? And like I said before, is it during the hours when they're working and they need care? And then you can see here that we have this 5th category of indicators, which is child, family, and community characteristics. These aren't necessarily indicators of access on their own, but these are really describe communities, and we need these indicators to get to some of the questions about access that are really focused. So if we want to know about what access is like in low-income communities, we really have to have some variable or some way of knowing where those low-income communities are. And so these indicators on their own don't tell us anything about access, but they're really important for asking questions and answering questions related to access. All right, so I'm going to just quickly walk through an example question related to access, talk about what indicators would need to be answered to this, data sets, and then provide you kind of a way to visualize this that will focus on the importance of geography. So the question is, what is the availability of high quality, affordable ECE by program type in low income areas? So you can see here, this includes indicators from each of the 5 dimensions of access. So within the reasonable effort dimension, this question hits on the supply of programs, the geographic location of programs, the affordability, so the portions of parents' income that they're using to pay, supports the child's development, the program's designation of quality, so this could be a Head Start designation, accreditation, quality rating, meets the parents' needs, the program type, and then within the child, family, and community characteristics, the community income level. So this is a fairly straightforward question related to access. It's pretty typical and one that states are often asking, like what is this number of available programs? And I want to really know what that looks like in these specific low income areas, but it's actually addressing several different indicators of access across the dimensions. And you can see here there's also a list of data sets. So one of the challenges to measuring access is these data are often housed in different places and they need to be merged in a meaningful way. So that's really one of the biggest challenges, and it's one of the biggest challenges to tracking access across settings, because there's often Head Start data, state pre-K data, and then data about childcare programs, and bringing those together is a challenge in its own. So there's a lot of data out there, but there are some limitations like the merging of data that really prevent or have prevented in the past tracking access. Okay. So I'll just going to skip ahead and show you this. So this is a map that some researchers in South Carolina shared with me and allowed me to share with you. And it just gives you a sense of how you could take data for this question that we've proposed and really visualize it in a way that's meaningful. So they had a similar question to the one we were talking about, but they were really focused on looking at more utilization of high quality ECE, and specifically for families who receive a voucher or subsidy. And so what they did is they mapped the utilization of subsidy families by zip code in the state of South Carolina, and then used coloring to kind of identify where these families were having higher than average, higher than they would expect utilization, and those are the green areas of the state. Typical utilization, those are kind of the cream color, and then low utilization as compared to what they would expect, so those are the red colors. And then white are zip codes where there are no families who receive subsidy. And so by using this process, they were really able to identify the locations within the state where families who receive subsidy aren't really getting or aren't being able to access the high quality care that they would expect. And so that really addresses this first purpose of tracking access. They were able to set a baseline. And by using this information, now they can move forward, develop initiatives to really address why those certain areas or why families in those certain areas aren't accessing ECE that's high quality at the level that they would expect. And then they can really track that over time. So now they know where they are now. They're implementing initiatives to address that, and as they move forward, we'll continue to do these analyses so they can see the impact of that, with the hope that these areas that are in the red will move to green. So I'll just wrap up and say that there's a lot of data being collected about access, like I said before, and really the first step would be to mine that data fully. So data that are collected for Head Start, for state pre-K, about childcare programs. Like I said, one of the first steps is really to bring that data together, to find a mechanism to merge it and be able to analyze it across data sets. But there is a lot of data out there, and really states and programs and localities should be focusing as a first step on posing some simple questions, finding the data that they need to answer those questions before they take this next step of going forward and collecting new data. And really the purpose of tracking access, doing initial analyses, and then tracking over time is to inform some continuous improvement. So this example from South Carolina, that I think that's a really great way to both visualize the importance of geography and then to provide them with baseline and ongoing data so that they really have a good sense of what's happening as they move forward and implement initiatives. All right, and that is it.
Good morning. I'm very glad to be here today to share with you some of the promising developments that have taken place since this initiative started in February of 2015 for us. And I'm not going to worry about it. We'll speak without it. Okay. Starting with professional development for staff, which in the beginning with our child care partners was met with a lot of resistance, very much so. Not understanding that there is a formal approach to interacting with infants and toddlers. But after going through some of the initial training, they got on board. I'm pleased to report that we have 100% compliance with CDA credentialing with infant toddler certification. So that was a major undertaking, but and we have a lot to be thankful for when working with our state, Grow New Jersey Cares, who helped pay for a lot of this and took the burden of that financial piece off of the staff itself and having to meet that goal, but it was met. Then we're also pleased to report 100% parent satisfaction in accessing care. We have written reports from parents who talk about what the program has meant to them, how it has changed their lives, the quality of care that they can now see coming forth, the development of their children. So we are very pleased in that area. We also have met the 100% goal of all physicals and immunizations are up to date for all children across the board, Head Start and child care. And I work with 2 child care partners who are vastly different. Okay. The interaction with infants and toddlers, we've seen a very marked improvement with that by the use of a formal research-based curriculum that the teachers now have a greater appreciation for, since someone has come in and trained them on how to use a research-based curriculum. So that has been a plus. Then there is the parent and family engagement piece, and I think the parents enjoy that most of all, because they now have someone sitting down with them and helping them set family goals and initiatives and draw out a plan on how they're going to accomplish them. And then that data gets collected and is followed through for the course of the year on what steps were taken and did we accomplish the things that we helped the parents establish. Then, and I know this may sound why is it so important? But the quality of food. Quality of food. Okay? Having that nutritional component there for infants and toddlers and what we're serving children in the centers. And my program has been involved in a big obesity campaign with Rutgers University. And so we've been able to transfer that into the centers also. But to talk about that quality, and parents talk about the fact that they're not scrambling on what are they snatching out of the refrigerator in the morning and bringing it into the center, and they know that there's a consistency of quality nutritional services there for their children. So that has been very, very important in meeting that goal. Those have been our major accomplishments with this program, but there have been some challenges, just a few. One of the biggest ones that I think we need to begin to focus on, and we have in New Jersey, is programs have difficulty. Oh, they got it up there. Oh, okay.
There it is. It's there now.
Okay. Programs have difficulty being sustained as Head Start and Child Care funded slots do not have continuity and eligibility. So we're not talking about money, we're talking about eligibility. They are so vastly different that a child care agency can lose that slot at any time during the course of the year, and then the work is for naught for a child who's leaving the program. And while each Head Start program under this new initiative was asked to put in sustainability funding, it doesn't work the way we think it works. You think that, oh, one child may lose a slot today, and that's fine, and another one tomorrow, and you have the dollars and you can replace all that. But what happens when a center loses 40% of its enrollment at one time? There has to be a better plan on how we're going to sustain those children and help them remain within the program so that we can have that continuity of services and high quality. There also has to be more continuity at the state level. The state operates various plans where you can have parents who are in TANF who are not eligible to come into the child care program unless the parent is working or in school. And that's a wonderful thing. Parents should work if they can or be in school if they can, but you don't penalize the child if the parent is unemployed at a certain time, or if the parent gets pregnant and can't work, and you snatch the child out of its slot because now there's a new development. Well, what we're looking at in New Jersey is ways to address that issue. One should not impact on the other, and what I'm saying by that is the status of the parent at any given second should not impact on the quality of care for the child. That's what it should be. And we have been working hard in New Jersey with our child care partners and community people in order to say, this is what we need, and how are we going to get there? We are also looking at how we collect data. Collecting data in New Jersey is a very hard thing. There are records on live births is up to date maybe every 3 years, or 5 if we're lucky. But we have to go into the hospitals, and we have to deal with TANF, and we have to deal with WIC, and we have to deal with other social service agencies just to pull that data together. There should be a best practice across states on how do we collect data on infants and toddlers, and how many are out there that really need service, and are we really reaching that population level that we want to? We can't be exactly sure if we have to spend so much time trying to find the data, and by that time we've lost so many months on implementation of services. So we need to talk about that. Then I had a long talk with Shannon about the 10-hour day. The 10-hour day is a really challenging thing. And it's not up here, but we decided we were going to talk about it. Really challenging thing. It is humanly impossible for 2 employees working a 40-hour week to do 10 hours a day. Under a regulation that says you must have 2 people in the classroom at all times. There is no lunch hours, there's no break time or restroom time if this rule is so stringent that it's 10 hours, 2 people all day, and that's what you have in your budget, 2 people, and how did you do that? Well, in New Jersey, we call it blended funding. We have to have other resources out there that's going to pick up at least 4 hours of that day. So the child is truly getting a 10-hour day, but 6 hours is Head Start and 4 hours is the other source, and that way we're able to bring a third person into the classroom. And so what I've been advocating for, 3 people in a classroom, no matter what grant it is and whose money it is, 3 people in a classroom is what we need, and we have to have a way of getting it there. And we're working on it. It's hard, but we're working on it. So all the other issues I talked about in the beginning, when a child uses a subsidy and all that great stuff, that impacts on how do you maintain those 3 people. You got it. Those 3 people in a classroom. But other than that, we have found it's been a very interesting project. It's been challenging. If you are a Head Start grantee doing this, you need more staff. But it has been ideal to watch our partners grow. And we have made some new friends. We really have, and it's been a great experience. Thank you.
Okay, so my job is to sort of pull some of this together and wrap it up, but I think Veronica did a great job. I'll just say a few things that jump out to me based on some of what Veronica said, where I think our research friends can help, and then where I think some of this definition will have real implications for our practice. So first of all, I think you heard really clearly in Veronica's example about the 2-generation idea that we were talking about, that parents need to work and go to school, and children need care that is high quality to foster their development, get them ready to school. And you know, while both childcare and Head Start have been moving to embrace both, we kind of have a history where childcare has been focused more on work and Head Start's been focused more on the school readiness part. And we've been working through policy to bring them closer together. The new childcare reauthorization law has a lot more in there about child development. On the Head Start side, I mentioned we've been looking at lengthening, but also partnering to try to meet more of families' work needs. I will tell you that research has been integral to that effort. Especially, I mean, I can speak mostly about the childcare side because that's what I worked most intimately on, but we really relied on research. We relied on research about the importance of stability for kids, the importance of quality for kids. We relied on research about why continuity would be important, why they would need to be in the same place for a long time to try to cut down on churning that Veronica's still experiencing. And now we're about to implement these new regulations and this new law, and I will tell you that the work is not done. In every state, they are still making decisions about that. And so now I'm looking at you, developmental psychologists. We need people who can go and talk to our state partners, to state legislators, not to opine about things that you might feel are beyond your, but to explain the importance of quality and stability that would really inform decisions that would allow families to keep eligibility for programs over a longer period of time. Because we actually used all your research to get to the point we're at, and we need to keep using it to get to the implementation point. So I would really invite you to get really deeply engaged with your state folks. And, you know, when I think about it on, the other thing I would mention is in terms of the supply of care for infants and toddlers, which we've talked a lot about. And I think that the example, it was not an accident that we chose an early Head Start childcare partnership to talk about that, because we know that's where we have supply gaps, and that's another place where maybe our data wonks, rather than our developmental psychologists, could look at the mapping that was done in South Carolina and other efforts to map to help us have graphical representations about why 4-year-olds are not the whole deal, right? And in fact, in a lot of places, we actually have, we're not done with supply for 4-year-olds, but we have more funding streams focused on 4-year-olds than we do on infants and toddlers currently. And I think that graphical representations of that, being able to talk about that, is also another place that folks could be really helpful and come together around. And one of my favorite things about the new definition is this idea of reasonable effort, which I think is a great evolution on some of the parental preference and choice work that we had done. I think it takes it to a new step, and also is a place where this definition has real implications for those of us on the policy and implementation side. Because what is a reasonable effort? And I hope that, you know, this is something that can also inform implementation in both Head Start and child care for programs. So for example, to me, a reasonable effort involves being able to set up systems so that families' default choice, to use some of our behavioral economics at Operius one, the quickest, easiest choice to make is the one that's going to be high quality. Or that if you come into a child care subsidy office and you apply for a subsidy, but you have a 4-year-old below poverty, they try to refer you first to Head Start with a voucher to do the full day, full year that Veronica is going to need to meet your work need. And I've heard too many times where they feel like because of data, privacy, something, we can't, we don't make the referral to Head Start. I've also heard that folks aren't willing to share waiting lists across the two programs. And if we were sharing waiting lists across the subsidy waiting list or Head Start waiting list, we could be working on that. So all of that helps with that reasonable effort idea. And I think that it also helps with Head Start outreach, right? I think Head Start could be set up right there in the subsidy office to help families. So all of that, I think that reasonable effort is a simpler and easier way for us to wrap our minds around, like, well, what would it take to help families find us with what is a reasonable effort? And then I'll just say a little bit about the uses of the work that you saw from Sarah. I think Sarah did a great job, especially with the map from South Carolina, showing one of the state planning. And I think that is great for our state child care folks and for our state early care advisory committees, and also for our Head Start Collab directors who are here. I think that kind of mapping is fantastic. I would also mention on the Head Start side, that kind of mapping can be incredibly important for Head Start community needs assessments, because we've really been thinking about how we can make those needs assessments richer and better. And especially as we look at more funding streams coming online for pre-K, one of the things we've been trying to figure out is, can more Head Start grantees apply to convert some of their slots to early Head Start slots? And I think that to do that in an intelligent way, you would really need the kind of data and the kind of framework that Sarah has rolled out, and that, I think we would stand ready here at ACF to help Head Start grantees think about how they can increase the sophistication of their community needs assessments to look across all the different funding streams that are available, and also understand needs for 3-year-olds in their community and needs for kids younger than 3. And I think that's a huge implication and possibility. And finally, all of the colleagues who helped us plan this presentation wanted us to end by talking about the importance of partnerships between researchers and administrators on this work. And I think that the examples I gave, I tried to show why those would be important. I think it is fantastic that the example that was from South Carolina, where there is an extremely long-standing partnership between the state and the University of South Carolina. They've been working together for a very long time to make management decisions. And I think there are certain insights that come out of working together like that. And I'll just give one example that I've heard over the years, which is, sometimes I look and I think, well, gosh, we have all this licensing data. This licensing data should be a gold mine for people about care and where it is. But there's a couple of things about it. One is it tells you how much a person could legally do, but not what they're willing or able to do, which is sometimes a lesser amount. They call it desired capacity in the framework. So there's a tweak there. And the other thing is, apparently in some states, there aren't great data about when programs close down. So then you really, once you close down, they don't come in and close it out of the database. But if a state child care administrator, for example, or a state licensing director, maybe in the SAC, right, maybe in the advisory committee, are sitting with the research folks at the table at the same time, they could start talking about, well, we don't have data on this. Maybe it would be cheaper and more feasible to clean up the licensing data or make a few tweaks to it than to go out and start a whole new data set to get at this question. But I think that's only the kind of thing that's going to come out in dialogue between a researcher and the folks who own the database, the administrative database at the state. Because I don't think either party is going to necessarily think of that on their own. But sitting together, those kinds of things will come out. So with that, I hope that this has set you up well to think about how we come together for the next 3 days, to think about how we answer each other's questions across program, policy, and research. I know that on behalf of the panel here, we really enjoyed doing that as we were getting ready for this presentation. And I wish you a productive and learning-filled 3 days. Thanks.